All right, welcome back everyone. We're going to move to our next session now, which is addressing the mental health challenge. We go to our next slide. It's my great pleasure to hand over the moderation of this session to Peter Varnum, who leads global mental health programming at the World Economic Forum. Our other esteemed panelists that will be joining this conversation include, to my right, your left, Dr. Victor Zhao, who's the president of the National Academy of Medicine and also serves as the chair of the Innovations in Healthcare Board of Directors. We have Garen Staglin, who's the chair of the board of One Mind. Nicole Bardikoff, who is the program director for global mental health at Grand Challenges Canada, also joining us. And we'll have this conversation. Husseini Munji, who's a global therapeutics area head for neurosciences at Johnson & Johnson and Janssen, will be joining at some point over the course of the conversation. He's been called away to an urgent meeting internally, and unfortunately, Dr. Murali Doraiswamy here at Duke won't be able to join us this morning due to a last-minute schedule change that's urgent here at Duke as well. So with that, let me turn it over to Peter and welcome all of our panelists for this conversation.
Excellent. Thanks, Krishna. Can you guys hear me okay?
Yep.
Perfect. I see, Krishna, you're exiting the picture. I was going to give you
and I'm just pushing him out.
I was going to give you a little bit of a hard time because my college basketball team, Kansas University, was looking really good, and I saw the KU initials from you on your screen, and I know we have a nice rivalry going. Anyway, it's a pleasure to be here with all of the esteemed guests, and thank you everyone for being here. Just again, so everyone is aware, we have Victor Zhao, Garen Staglin, and Nicole Bardikoff here with us. We're going to go through this session on the global mental health challenge and how technology and innovation can address it for the next hour. I want to give you just a sense of how the discussion will go for the next hour before we jump into those remarks in the conversation. So we'll let each panelist have a couple of minutes, 3 or 4 minutes for introductory remarks, and then we'll launch into a discussion after that for the majority of the session. And then of course, we'll have a bit of Q&A from the audience as we've seen for most of this morning before we conclude. Before I turn it over to you, Victor, I want to just ensure that everyone knows the reason behind our having this session. So obviously a lot of shifts. And again, thank you to Judd and Krishna and the team at Duke for shifting on the fly. But the purpose of the session today is really to discuss in greater detail the potential benefits of technology and mental health, including some of the obstacles and the opportunities that we're facing. And I think it's apropos that we heard this morning from all of the innovators already. And now we'll get to hear a little bit more on the high level thoughts of people who are working globally. So with that, Victor, I turn to you, and maybe if you could just give a sense of the challenge and the opportunity globally, other comments that you might want to make to start off. Over to you.
Thank you. Thank you, Peter. And it's great to join this esteemed panel of experts to discuss a very important issue, which in fact, you all know, which is brain health or mental health, but we think about broadly as brain health. I think that all of us recognize that this is a very important issue from the health viewpoint, but also from societal viewpoint. The burden of disease is huge, and the cost to the society is substantial. And I think everybody should care because this impacts not only on health, but families, economy, security, you name it. And the numbers are only getting worse. So I'm going to say, tell you a little bit about the global numbers. First of all, mental health and substance-related conditions are a great contributor, most important contributor to global disease burden, is the #1 cause of disability for adults globally. Approximately about 450 million people worldwide live with a mental illness. And if you look at who's impacted, I would say that 1 in 4 people will be affected by mental or neurological disorders. 90% of nearly 1 million people worldwide who die by suicide each year usually have a psychiatric condition. Also, it's a major cost of world economy. It costs about $3 trillion annually from both cost of care, but also the loss of productivity and so many other issues. And an estimated 12 billion working days are lost per year due to mental illness. So these are very big issues. If you look at the US, about 20% of Americans have a condition of mental health or substance use disorder, and 60% of those who have substance use disorder also have mental health condition. And certainly we can imagine the impact on disability and the risk factor for death by suicide, incarceration, and homelessness. So we also know that it's linked to chronic disease. In fact, mental disease and physical disease are closely linked to each other. So the question really is, why are we here and what can we do about this? First of all, I think that the world sees mental health generally as something they don't want to deal with as much. There's a big stigma. Everybody knows that. In different cultures, different countries, people don't want to talk about this, and certainly sometimes it's thought to be a weakness of your personality or others. Second, of course, is the amount of resources that's put into addressing the issue of brain health. To begin with, in low middle income countries, a very small percent of the GDP is allocated to health, maybe 1%. And of that, mental health gets really to the kind of bottom, if you will, of the ladder. Access is a real problem. 1/3 to 1/2 or more people with serious illness do not receive treatment in our country and everywhere else. And of course, we don't have enough workforce. If people think that you need to access specialists, there are not enough people who are specialists in behavioral health. So the question is, how do you actually enable people who know how to deal with these issues and provide them with access and the right workforce? Our healthcare is highly fragmented. And so even accessing care for mental health is a very difficult problem. And as I said, there's just not enough resources addressing this issue. Now, in 2015, the ratification of Sustainable Development Goals recognized the promotion of mental health, prevention of mental health and substance use disorders, and universal health coverage as targets of a health goal. And of course, we all believe in it. The question is, how do we achieve this? Now let's talk about some upside. There has been advances in technology and neuroscience and understanding better the brain, the development and genetic disease, and the pathology. There are digital technology like telepsychiatry and others which have been helpful. So you're going to hear later on about this application of these advances, which I think are very important. But we know it's simply not enough. We know that billions of dollars spent in Alzheimer's, dementia, and that's not yielding much progress. But if you think about the majority of mental health, which is in the younger population, the youth, 70 or more percent actually in the youth from age 10 to 30. And of course, that's a very important population that needs looked at. So in summary, I would say that this is a global problem. This is a problem that we must deal with if one were to progress with a healthier and more productive society. But importantly, of course, we want to be sure that people who are afflicted with this problem are dealt with. But there's now more and more information on brain development and brain pathology. We should be able to actually take advantage of this and make a difference. What we're missing, quite frankly, is the investment. Now, so you're going to hear from my good friend and colleague, Garen Stacklin, about the initiative. I would just put it this way. I think we all recognize that investment is needed. A bold step going forward is absolutely needed. We can't really do things business as usual. Back in May 2018, the World Bank called together a meeting called Brain Bond, B-O-N-D, arguing that if we can find a new way of financing brain health, maybe we can really invest in the right things and move forward. So I look forward to hearing from Garen and from the others about this whole very important panel of discussion, how we can really address this very important issue for all of us. Thank you.
Thanks, Victor. And you will certainly hear from Garrett and others. One thing I forgot to mention, generally speaking, on this this type of arrangement, if you as panelists could just announce where you are and you know, physically just kind of get a sense of who's doing what. I could see Garrett making some coffee and being sure that we're all here. I know that Victor.
Gary's got people in the background moving around. You know, I say, okay.
That's
At
right.
least his grandson is not behind him. Yeah, so I took the risk of leaving my home and came to this Duke Global Health, the Innovation Healthcare Center. With us are 4 individuals. I think we all are highly hygienic and we're 6 feet apart. I think we're okay. My biggest concern is, in fact, I'm going to be at the airport this afternoon. And well, okay, you know, I'm going to keep my distance.
Definitely keep your distance. I'm having a problem getting my aging parents to stay in these days as well. So I'm in Geneva, Switzerland. I have the option, I think, and I think my organization would want to have me have a different sort of virtual background, which looks like this, but I find, you know, a little bit too futuristic and I wanted to keep things a bit lighter. So I'm keeping my friends, the Beatles, in the background. Nicole, over to you in, well, I'll let you explain where you are and what you're up to here to talk in terms of what Grand Challenges Canada is doing in global mental health.
Thank you. I was just saying thank you to you, Peter, for the introduction and for having me here. And I am in Toronto. I'm working from home. Grand Challenges Canada has given us that option, and I thought that I was fortunate enough to have the opportunity, so here I am. And Victor, that was such a great introduction to so many of the challenges and things that the field of global mental health is looking at and dealing with. And I'll give a little bit of a background on Grand Challenges Canada. So we are an organization that, for anyone who's unfamiliar, we fund and support innovation to save and improve lives in low and middle income countries. We have a number of what we call targeted challenges, and global mental health is one of them. It was a program that was actually initially launched in 2011, so it's been around for some time. Has funded over 95 different projects in over 30 countries. And we look at things and we fund programs at both what we call our seed and transition to scale level. And if anyone wants more information about how Grand Challenges Canada does things and what these different funding programs look like, I would say go to our website, and I won't spend more time on that today. What I will talk a bit about is how we've chosen to focus our global mental health program. Some of you may know that we haven't had new funding calls out from that program for some time, and I'm really excited to be able to say that that is changing. We are really relaunching and coming back into this space. We're going to have our first call for our new seed funding proposals out in May, and what we've decided to do is focus this on young people's mental health for so many of the reasons that Victor was talking about before. You know, knowing the time of onset for so many mental health challenges are during this phase of youth, and if we can intervene and provide support early, we can have a lot of impacts on so many different domains. So that's where we're looking to focus, and I would say that some of the things that we have found and what we'll be looking at and looking to support moving forward is innovations and programs that really are community driven and community based. You know, we know a number of the innovators previously, and Victor have spoken about a lot of the challenges about providing support in areas where there's not enough resources, where we don't have the same kind of perhaps mental health specialists that you might like to see to be able to provide that kind of care. So if we can find, we really look to support innovations that are driven by the community, that are well integrated in, and that take an innovative approach to how we can provide care and support, whether that be through task shifting, whether that be through leveraging technology to be able to get services to individuals in areas where they perhaps wouldn't be able to access these otherwise. And one of the other things that we really look for are innovations and programs that are, of course, able to show that they are effective. And that's an area where we at Grand Challenges Canada are able to support some of that through what we call our learning platform. And we've done that in the past. But we really, and I know we'll talk about this a bit going forward, but being able to measure and track your impact is so important for being able to have to show why and how you can be sustainable, to be able to leverage more funding. I know that was something that came up in our panel previously as well. And then the other really key thing that I think is really important for us to be thinking about, and one of the things that Grand Challenges Canada looks for and will continue to look for, are things that really take a wraparound approach. So being able to provide programs and support and treatment is really, really necessary. And then what's also necessary is being able to then support that individual to go back into a context that has a better understanding of being able of what they need and what's happening in their lives, whether that be involving family, involving teachers, being able to integrate into systems that exist and educating those individuals as well about mental health, and just really being able to work on mental health literacy in a really, thoughtful and intentional way to go hand in hand with being able to provide treatment and support. So with that, I will take a pause. And I really look forward to hearing from Garen and to the rest of the panel members as we move forward.
Great, thanks very much, Nicole. And I think that emphasis on cultural context, on community-based interventions, certainly we heard a lot, as you mentioned this morning, from how people are scaling innovations in places where there aren't enough specialists to meet the demand. And I would even argue that the solution anyway, even if there were that many doctors or specialists, would be that it needs to be more community-based care. So thank you so much for giving us a broad brush. And as you say, we'll come back with more discussion throughout the hour. Garen, I'm going to turn to you, and I'm going to remind you to just unmute yourself before you start talking. And I know that you've been working, as Victor mentioned, on the Healthy Brain Finance Initiative, and you have some slides to support that, but I'll give the floor to you to do your own introduction and how you want to use this next few minutes. Over to you.
Thank you so much, Peter, and it's my pleasure to be with all of you this morning. I'm here in Napa Valley. It's usually blue skies, but I think apropos of the global environment, it's kind of cloudy and raining here today, but we're not deterred. Our attitude is positive, and we're moving forward. Just to set the stage here a bit, and I guess someone's actually put my slides up to get started. So let me just say that my motivation in all this comes from the fact that this is very personal to me and to my family. My son Brandon had a psychotic break in 1990, and since that time we've been running towards this problem, pushing the envelope and accelerating research, trying to work in translational activities, and also working in society with programs in workplace as well as in media and culture. But I won't go into that today, but I would love to talk to all of you about the Healthy Brains Initiative, which Victor set the stage on, showing that global need and how significant this is. So we could go to the next slide. Am I advancing this, or are you guys doing it? There we go. So this is what we're trying to accomplish with this Healthy Brains Initiative. This is an unprecedented effort. Never in the history of global science has the global community in a field, in this particular case, neuroscience, come together to build a plan, to build a set of objectives, and to work together in a collaborative way to try to dramatically alter this economic burden. As you can see here, we're dealing with a $3 trillion global cost curve. And Peter, your organization has said that that $3 trillion is going to go to $6 trillion by 2030. So as bad as COVID-19 is, it is nothing compared to the incident rate, the dramatic cost of disability, suicide, and everything else that goes with it. So we are crafting a series of financing initiatives. If we go to the next slide, you'll be able to see our approach here. So we've brought together this incredible group of people and collaborators with both World Health, World Economic Forum, World Bank, National Academy, and Bank of America has now joined us as our lead underwriter of this effort. and with advice by the National Institutes of Health, OECD, and others, I call your attention to this quote at the bottom from Tedros, talking about how important it has been for us to think creatively about new science, new funding, from bonds to direct investments. And we're very pleased for the strong endorsement and partnerships we have. On the other side of the slide, you can see the partners that we have already secured startup funding. The Wellcome Trust is not on the phone with us today, at least I don't think so, but Miranda Wolpert and Ed Whiting are clear and very active components of what the work we're doing, along with the other members that you see here. If I could go to the next slide. So our approach to this very significant effort has been structured around us forming 4 working groups of global leaders around the country, defining the research priorities, and apropos of what Nicole said and Victor said, we're starting with the crisis of youth between the ages of 11 and 24. This is where our research programs and our funding will begin. We're developing alternative finance structures. I'll show you a brief slide on that, of different ways for people to contribute. But think sovereign wealth funds, think direct investment, think high-level philanthropy, and other sources of general obligation bonds of states like the state of California to be joining in with us. We're developing a set of metrics that will help us measure how well we're doing, and led by Brad Herbert and Tim Evans, we're establishing governance structures that will emulate what has been with the Global Fund on AIDS and tuberculosis, as well as Gavi, to allow us to ensure that the best science on a competitively based basis is funded, and that we collaborate and share this information in an information commons around the globe. May I have the next slide, please? So this is just to give you a diagram to say that we're going to be looking at a variety of different sources of funding. Green bond funding is a term that if you're in the capital markets, you would understand. There's already precedent for this kind of impact-based financing that has been done in carbon and other footprints like that. And we're very fortunate to have the experts from Bank of America working with us to actually help structure and deliver these bonds. We also have Valerie Cohn and the Science Philanthropy Alliance and other philanthropy sources working with us on donor direct financing here. Victor made the point, but just to make it to you again, these illnesses are 4% of the GDP of most countries and going up. So this is a very good investment for them to proceed with us. And I can tell you that the subject of the return was documented for us by the $3 billion bonds that were issued by the state of California for stem cell initiatives that have now documented a return of almost 11 billion for the state of California, almost 4 to 1, and additional benefits up to 5 to 1 if we take all of the United States. So we believe that the people who participate will see direct benefit from this, and eventually the world, because it's our clear intention to disperse these new discoveries across the developing world and the developed world. And as your prior panel said, when it comes to mental health, the whole world is a developing world. May I have the next slide, please? This will give you just a quick idea about how a 20-year financing instrument would actually show the benefits that would be generated. And if you look at the dotted line that's going up on the top, that is the net benefit using the California economic model. The below the line is the actual investments that are being made by a sovereign fund. Let's take Norway to be one of those, or Qatar or Singapore. And you can see that the net of the green versus the blue is such that the return is dramatically higher on a $1 billion investment, which is the kind of the target that we're looking for investors in this space. So we're quite excited about the opportunity to present this globally. Next slide, please. And through Victor's relationships and mine, and Peter, thank you for giving us the opportunity to host a multilateral session at Davos 2020. We're building a very strong list of potential participants. So this is a very rudimentary diagram, but you can see philanthropic funding coming in, sovereign donors coming in, a governance board, and then various entities authorizing and distributing grant funding with some country-specific implementation and some otherwise. And then the HB financing facility, we may change that to the word institute, will actually then be oversighting and managing all these particular activities. So it's a very ambitious effort. That would be an understatement to say the least, but our momentum is strong with the participants we have. Next slide, please. We are very confident that this group of people and the 50 or so people working underneath them are committed to making this a reality, and we're hoping for first rounds of funding in 2021 in the range of about $250 to $300 million in 2021 and ramping up from there. So exciting opportunity, new finance, new science, all addressed to try to bend this $3 trillion cost curve. We're quite excited about this and confident we can do so. So I will turn this back over to you, Peter.
Thank you, Garen. Appreciate it. Thanks for that information. There's a lot there. It's very exciting, a lot to unpack. One thing I do want to come back to later, just so you can prepare, is if you could speak to the way that that $11 billion return is actually quantified by the state of California. I know it's a broader societal quantification as opposed to just the financial return. So I want to come back to that. But before we do that, I do want to open up to the broader group about a key, I think, message in this global space, and especially for our audience, many of whom are innovators who are trying to understand how to plug into this global space. And that question is around the importance of collaboration and what we're all doing together. So all three of you mentioned youth as a target area and sort of the importance of coordinating there. Maybe I'll start just, Victor, with you and add another question on top of it as well, which is, I know that the National Academy of Medicine has science and evidence base as its sort of main driver in terms of how it's trying to accomplish its mission. Right now, we're seeing a lot of mistrust in institutions around the world. And so how do you ensure that the broader public has an understanding of how important that science and that evidence base is? How do you communicate that message? And then to my earlier point, how do you ensure that that message is being coordinated among all of these different actors?
Yeah, thank you, Peter. First of all, Nicole and Garen, outstanding presentation. I want to expand a little bit on what Garen said, because we call new finance, which is clear, $10 billion, new science and new life trajectory. So the question is, how would the money be spent? And Garen pointed out there's a group called use of proceeds, right? And this group is thinking about how do we actually make a big difference? And I'd like Garen to talk a little bit more about this, but clearly we think about breakthroughs, we think about implementation, where there's so much known that can work that's not being implemented in the low and middle income countries. There are many other issues. So maybe I can turn to Garen first for him to expand on. It's not just a financing thing. It is what we do with the money that can make a huge difference. Garen?
Yeah. Victor, thank you so much. Yes, and absolutely right. This is, again, the purpose of all this, right? Because we have to do this right in order to have these incomes. So we're categorizing our efforts across three major areas. Implementation science, which are places where we can actually follow along projects that we know are already working, but can be implemented more quickly on a global scale for impact. Early intervention for kids at risk for psychosis is one of those areas. Potential for delivery of better treatments for ADHD with medicines we know that are more effective than those that are not working. We're also going to be working in translational science, where we'll take compounds that perhaps could be repurposed and accelerated, or other methodologies where we can bring impact on a shorter scale basis. And then we'll also be looking at the long-term basic science around biomarkers and other indicators that would allow us to get to the root cause of these illnesses. Because we still need a lot more to know about structure, about chemicals, about signaling across aspects of the brain. And this team of scientists that we have working on that are working hard, meeting twice a month now in 2-hour sessions for the next 2 months. And we hope to have 3 or 4 very clearly defined project areas in early returns, longer term science and translational activities for youth-based activities well before the middle of this year, so we can start to build around that metrics that will allow us to measure the return of the reduction of disease and improvement in quality of life. So Victor, I'll give it back to you.
Okay, Peter, before I answer that question you asked me, I want to expand on this because this is so important.
Sure.
First, if you look at what we can measure quickly in disease burden, we know that if we simply practice, as Nicole said, community-based, evidence-based approach and remove the stigma, being willing to do that, you're going to see some results, I'd say fairly quickly. So that's what Garen's talking about in implementation science of knowing what needs to be done. The other extreme end, as Garen's talking about, is discovery, breakthroughs, right? A brand new way of doing things, brand new drug, whatever, technology that can really break through. And that's so important. And then in between is the capacity. Because we're dealing with a global issue, you want to be able to do the research globally and not just in US or Canada. Hence the whole idea of translation. So I think this is well thought out in my opinion. And Chris Mary's team on measuring metrics will obviously take us to task to say, are the money invested properly? Are we getting return? And not only financially, but also from a health viewpoint. I just want to emphasize that because Garen's doing a great job taking this on. I'm glad to be his partner, and I think we have a lot of opportunities. The misinformation is a real problem because, as you know, we're living right now in the month of COVID-19. And all you have to do is follow what's on, social media, et cetera, all the misinformation. So we actually need places and trusted people who's going to speak for truth, for facts, and for science-based. There are many organizations that so, certainly in the National Academy, that's what we aspire to do. We've done a lot of reorganization of community. And in fact, in COVID-19, we'll be soon having a series of webinars on a weekly basis to put out the facts and the information for people to be able to look at, aside from what's coming out from our government and others. We recognize misinformation is a big problem. And of course, we have had a recent summit with the people working this space, including Google, many other digital organizations, talk about how can we work together and how can we actually make sure that there's some kind of mechanism to look at fact-based. It is, at the end of the day, a digital technology issue. It's at the end of the day, our governance issue. I think we all recognize how important it is. And I do think that that is an absolute important issue we need to work on. In mental health, there's so much myths and untruths that we need a place where we can actually truly give out the facts and information as we're trying to do in this panel.
Great, thank you, Victor. Nicole, thoughts on coordination?
Yeah, I think it's so important. There's never enough resources, of course, but there's definitely not enough in mental health, right? It's not a well-funded area given the level of need. So being able to work together, being able to be intentional, align where we can, both not to, of course, duplicate work, and because it's the best way to be, to be able to ensure success, right? Having funders be aligned, being able to support collaboration where we can with innovators. I think that's really key. And so it's great to see when, Garen, your slide with all of the different partners that you're working with, that's wonderful. I think that's exactly what we need to be doing as a field, is really bringing everyone together to best impact on these different areas. And the fact that there's so many, I mean, it's not a surprise because we're all doing it for the same reason, I think, but that fact that there's this increased focus on young people's mental health across so many different areas and so many different groups and organizations, I think just better sets us up to be able to impact on that area.
Yeah. So I think one of the things that continues to cross my mind, and particularly for this session and in this time, is the promise of technology in mental health. We hear about this all the time. We've done at the forum, we've done a lot of work on sort of potential and pitfalls of mental health and technology. We put out a report with one of our global future councils, which Murali co-chairs, on the ethical issues that are involved in scaling tech-enabled mental health interventions. Certainly we hear right now constantly on the news and from others how tech is a chance for us to stay connected during this period of what some call social distancing, which maybe is better termed as physical distancing, because we want to keep our connection. So I'm going to pivot there for just a second. I stole that from Shekhar, Victor. I see you. I see you reacting here. Shekhar Saxena had tweeted that out earlier. I'm going to pivot here a little bit to the current crisis, the pandemic with COVID-19, and also just kind of the longer term benefits of things like telepsychiatry, telemedicine, community-based interventions that can be delivered digitally, etc. Maybe Nicole, I'll start with you. If you have some examples in mind of things that you've funded or that you're aware of, or general thoughts as well on the potential and the pitfalls, for lack of better terminology, of tech and mental health.
Yeah, no, I think it's very appropriate right now, but also in general, it's an area that we should be using more and can leverage. I think that one of the things that that we always keep front of mind, and that I think is so perfect for, good that you gave him credit, stole from Shekhar, is that there is the balance, of course, of being able to use technology to get services to increase screening and support supervision. But of course, the thing we're not looking for in the field of mental health is increased social isolation. So being able to use technology to change that is, I think, really key. And one of the areas where we've seen technology used a lot, and I do think that this will be changing, especially as there will, I don't doubt, be an influx of innovation and capital in virtual technology right now, given what we are all experiencing. But what we've seen a lot from Grand Challenges Canada's portfolio is the use of technology around screening and around supporting training and supervision of community health workers. Now that makes sense given the context in which we usually are funding innovation and support. These tend to be resource scarce areas. But I think that that's an area where there can be more. And I think especially building out the ability to supervise over technology, and I know that came up a little bit in the previous panel, I think is going to be key. Because we want to be able to ensure the long-term quality, to be able to also ensure long-term support. We've funded a lot of task shifting innovations, and I think that those are really important and have shown to be incredibly effective. But we also then are putting in a massive amount of burden on these lay health workers who are doing some of this treatment and care. And I think being able to support them in a stronger way and supervise them is really key. So that's an area where I see potential for a lot more support and a lot more innovation and development.
Victor, maybe any thoughts from you before I turn to Gary on the use of proceeds?
Well, actually, as Nicole is saying, if you think about technology where we are today, simply having communication and connection, the social aspect is so important. But as you know, there are people who are actually using digital device to track people, particularly for those who are more vulnerable. And let's say you take bipolar, looking at the patterns of their usage in iPhones or digital technology can really, in many ways, early detect changes in one's behavioral pattern that can cause intervention. So there are many others, and as AI and others become a lot more useful, and these digital devices are really quite low cost and everywhere, one can imagine a real change in the way we manage these patients. Importantly, I want to speak to the 150 people who are participating in this meeting. This panel discussion about all this should mean a lot to them, because the fundamental idea of creating innovation in healthcare, in which Krishnan runs, who was one of the co-founders, is to say to all of you innovators, now this funding that Garen's putting together gives an opportunity for you guys to be innovative and come in with ideas that can change implementation, if not translation and others, right? I mean, so many of our members of the IiH are frontline innovators who've shown us that they can have creative ways of addressing, care needs. And of course, that's what the fund is for. If people come up with systematic ways of making care for the people with brain health more effectively, I would say, Garen, don't you think it certainly fits what we want to do? And it would also, as you come back to metrics, being able to show the change in disease burden.
Garen?
Yeah, absolutely. We are, the idea that we can break this traditional way of which science has been done is essential for us. I mean, we need to start working in new ways. We need to be able to look at breakthrough ideas and the funding of these through some early stage, some form of potential, something that might mirror the Dementia Discovery Fund that was put together under the auspices of Prime Minister Cameron. That's an idea that's in development as a component of the financing mechanism to stimulate new innovations. I would like to comment also on your point about technology. I mean, we have not discussed, but clearly the genome is making a huge difference in our ability to understand, because these diseases are by and large genetic mutations that are then environmentally triggered that cause these chemical imbalances. And Steve Hyman, who's a member who leads along with Miranda our Use of Proceeds Working Group, and the Broad Institute and the Global Genomic Consortium, has made incredible progress. I mean, we, as it relates to schizophrenia as an example, I think there's about 260 gene mutations, and we can screen somebody for those 260 mutations for less than $50. So that's a further confirmatory component of our diagnostic progress that wasn't available to us before. One other area of funding that we've been doing for the last 20 years, Peter, is the use of positive feedback loop, computer-based programming to take advantage of neuroplasticity. Plasticity is this wonderful thing our brain has, creating new pathways just by this conversation and all of us are listening to. And there's now over 800, I think, or maybe more than 1,000 apps trying to help people with cognitive and mood regulating disorders and memory using these apps. And we've created an independent review process called CyberGuide, PSYBER. So we're actually rating these apps with scientific evidency for both their effectiveness and privacy concerns and others. And so that's just two examples, I would say, where technology is now starting to penetrate people with these illnesses. I think I've pretty much talked about this use of proceeds area, but certainly the whole area of how we can help youth at risk is going to be our key focus here. And I'm hopeful we're going to be able to share with you these first major programs, again, as I said, by June 1st.
Great. Thanks, Garen. I have one final question, which links also to a question that a participant had asked on the Q&A function, and you guys are all welcome to continue to ask those questions. I will moderate them with the help of the IiH staff, and we'll get into that in a couple minutes. But before we do, and again, linking to one that was asked here, Garen, you mentioned, I'm going to ask all three of you the same question, but start with Garen. You mentioned this, the genetic mutations being there biologically, but then of course being environmentally triggered. And I think this is a huge component of the research that's understudied. And I think a lot of our panelists, and this is to the, our participants, this is to the question that was asked, are working in areas where those environments aren't very supportive to mental health, whether that's because of stigma or health systems or, you know, taboos or et cetera. So I guess the question is, how do we message this correctly as the research and the scientific evidence base is generated? How do we message that correctly to be sure that we don't overly step into, well, this is only a brain or genetic condition versus this is only a social determinant or an environmental question? They'll go Victor and then Nicole and then, sorry, Garen and then Nicole and then Victor.
Sure.
Well, understanding environmental triggers is where we need a lot of work. Let me start with that. We do know that things like serious illness in the second trimester of pregnancy can be a restriction in blood flow or disease burden that happens at that time, and that is very likely a environmental trigger. Stress and other social conditions, particularly abusive childhood, difficulties there, which also has some certain economic and societal issues that go along with that, are also factors that we know exist. But the relationship with how these environmental triggers then precipitate the illness itself is still not very well understood and a real area for our study, Peter.
Yeah. Nicole?
Yeah, agree with, of course, everything Garen just said, and then just thinking, so taking it to a slightly different area, like, you know, different, say, implementation and work area. I think it's important to be mindful that not every, you know, that there's no one size fits all, that the context in which, you know, these different innovators are working, or these contexts in which we're looking to educate people are different, and being responsive to that, being aware of cultural norms and differences that exist, and adapting to that specific context is really important. And I think that part of that is also just being open and upfront about, as Garen says, things that we don't know yet, and trying to educate on areas where we do. And so one of the things that, you know, Grand Challenges Canada is doing is that with our youth funding call that's going out in May, we'll be also looking at mental health literacy programs and being able to innovate in that space as well. Is that how we do educate people and how we can work with communities to try and be supportive in this area is also a space that is right for innovation.
Yeah. Victor, last word before we turn to our audience for Q&A.
Well, I think you said it all. I mean, this really shows how these are interlinked, connected, and, you know, multifactorial. And I think if we're to expand or extend what Garen and Nicole said, I would say, think about family members and the environment in which you live. Yeah. And because these matters a lot, think about understanding the brain biology. You know, what is it that an underlying genetic disorder can influence your brain growth and your response? What is it that environmental factors such as social determinants influence the brain growth and others? And what is it about the triggers? At the end of the day, it's mainly the brain biology. And understanding this, to me, is where the breakthrough is going to make a huge difference. So we need to bring all these things together, and we need to be able to find the right answer to these questions.
Agreed. Thank you all so much. Let's turn to the participants for a bit of a Q&A here. We only have about 10 minutes. I know there's been some chatter on there, but I'm going to look to Krishna and Judd to see if there's other things that we haven't addressed yet. Otherwise, we can go to some other questions for the panel.
Sure, thank you. I'll stay off camera here, but you can hear me. I think this is Krishna.
You can come over here if you want.
6 feet, Victor, 6 feet.
Here. But no, thank you all for a fantastic conversation so far. I think you know, one question that's come up from the audience is this idea of many of the folks that are here that are working in this ecosystem are also addressing poverty and operating in low resource and low income environments. So especially when you think about this intersection of poverty and health, certainly including mental health, how does that influence your thinking and what changes when you're also trying to address poverty in addition to mental health?
Yes, Victor, go
I
for it.
just want to emphasize equity. No matter what we do, our research and our decisions will address the issue, or at least be sensitive to the issue of equity. And poverty obviously is a big issue in this regard, as is many other factors. But I want to emphasize the issue of equity.
Tell us more, Victor. What can we do, those of us who are working either kind of systemically or as innovators on the ground, to ensure access of the same types of healthcare to different communities, et cetera?
So many of the things I've been involved with, such as CEPI, as you know, another organization co-founded by World Economic Forum and others, as one of them. I think the issue of having access, having essential medicines, having vaccines that everybody can have, and therefore the issue of pricing and all those things need to be addressed. And so in that regard, when we think about our area, which is what we talk about today, and I know Nicole thinks about it all the time, I know Garen does for sure, that we want to make sure that whatever we do, it's actually for everyone and not just for those who are privileged.
Yeah. Nicole, I know that Grand Challenges Canada really prides itself on, how, well, every organization talks about impact and monitoring and evaluation in their own sort of language and everything. But speaking from an organization that is within that space as well, I understand how those definitions can change and can be quite specific to the organization. When we're talking about actually changing people's lives on the ground and what that means, tell me a little bit about how you, as Grand Challenges Canada, go through that sort of M&E monitoring and evaluation and impact evaluation process.
Yeah, absolutely. So each of our main outcome measures that we look for at Grand Challenges Canada are lives saved and lives improved. And each of our different challenge areas have their own results monitoring framework that we've developed with the help of our scientific advisory committee, with a number of different stakeholders that we've engaged with over the years. So for global mental health, we have a very detailed and rigorous framework that we look for in terms of what the data that we are gathering and that we ask our innovators to gather. And when at the beginning of each grant that we put out, we work individually with that innovator, with our knowledge management team, to set specific targets for them, specific to their program. Things that we look for include changes in symptom severity, changes in level of functioning, level of quality of life, overall well-being. We have different measures that we recommend are used for that, and we support our innovators to be able to track and collect data on that. We also look at different more immediate measures. So how many, say if you're looking to train, how many individuals have you trained? How are you managing this? How many different facilities are perhaps implementing this innovation? What kind of community engagement work is being done? How many people, are there changes in knowledge and stigma? So there's a number of different ways that and a number of different metrics that we look for, and a number of different ways that we measure those. And then we collect data we support our innovators and collect data from everyone as projects continue and we're able to align across the portfolio. And then we have our impact modeling, so we can project outwards. And that's done with a framework that was developed in partnership with the International Development Innovation Alliance of how we can project these things. So I know that, if you look at our website, we have projections for how many individuals our innovations will be able to support by 2030. And so we do each of those individually, taking a really conservative approach so we can be sure that we're not overshooting things here, but looking at pulling in literature, pulling in different sort of feasibility estimates, mapping out a number of different scenarios to be able to project outwards. And I think one of the things, as you mentioned, a number of different organizations look at this, and everyone says things, everyone's got their own different approach. And so we really look at these as living documents, and we regularly re-engage with innovators to even, a year or 2 years after we stop funding, to be able to check in and see where they are and continue to update those numbers.
Yeah, it's super helpful. And from my perspective, it makes a lot of sense to have this kind of mix of theory and academic research that goes into impact evaluation, as well as involving the innovators and the local communities for whom you're working. So I wish we would all do a little bit more of that. So we're coming up on time. I'm going to give each of you a last word. Garen, there was a final question that talked about the future of mental health and how multi-sectoral or intersectional it is. And I know as somebody wearing a number of different hats in the global mental health space, you have a very good handle on how this all fits together. So I'm going to start with you for that question, and then ask you and then each of our other panelists to discuss some things that they're doing right now to manage their own mental health during this pandemic. I will be glad to share my thoughts on that at the end before I turn to Krishna. So let's go, Garen and Victor, and then Nicole, and then we'll wrap up.
All right, on that first question, I think, look, these diseases don't know any economic, gender, racial barriers. They are the same. The incident rates are the same across the world. So we must think of it as a global problem. My dream is that we will start to think about brain health as a spectrum that we are all on at any one point in time. Victor's going to get on an airplane. He's going to have a lot of stress, worried about COVID. When he gets back to his home, his mental health, his brain health is going to be different than it was had he just had 8 or 9 hours of sleep. So the whole area of stigma and discrimination, I'm hopeful will be changed by our attitude of understanding brain health as a spectrum. And the work that we're doing will lead to better diagnostics, better treatments that will ameliorate more than just symptoms here within our lifetime. I'm excited about how this new financing approach will accelerate it. As to how I'm coping with anxiety, first, grandchildren are great for that, so they keep you happy and completely distracted. And I think most of you know I'm in the wine business, so a great glass of Cabernet is always food for thought and food for comfort. Yes.
Victor?
Okay, so first of all, I didn't want to not address the poverty issue. I think equity is important, but I would surely say that we recognize, of course, these social determinants are so important that we have to address them. So in the work that Nicole and other people are doing, I know they are, and certainly in National Academy, we're very much into the issue of social determinants, and job poverty is an important one of them. And I know that Garen and I, as we look forward to launching this whole initiative, that we pay attention to how to address this issue. It's a very complex socio-economic issue that, of course, well beyond any of our capability, but nevertheless, we can certainly look at the environment in which it creates and how that is affecting mental health. And certainly, we do know that in the early ages, this is going to have a tremendous important effect in development of the brain with regards to early childhood and others, and how this will in fact be addressed. So I just want people to know that this is very important to all of us. I know that for a fact from my colleagues. So the issue of the COVID, I would say that I've been extremely occupied. And Garen, I'm sorry that I didn't have much time because we're raising $8 billion for COVID through GPMB. This is the Global Preparedness Monitoring Board. And in fact, yesterday we were in touch with Macron and with von der Leyen, and they are G7 today discussing a proposal among many others. So we need the money urgently. For myself, I think, first of all, I'm so glad the Academy has decided to let everybody work remotely. I think we need to think about the health of everybody, and the issue of physical distance is important indeed. For myself, actually, I tell everybody now suddenly we have more found time because Gary and I were on the plane a lot, and now suddenly anybody who says no to me, I said, come on, you're not traveling anymore. You have more time, right? And more time to read, more time to think, more time to write. And guess what? My wife and I played 9-hole golf yesterday morning at Hope Valley. And because nobody around, there's the two of us, it's great social bonding in playing golf. And even though we're not quite 6 feet apart, I think some of the time we were, because I was playing so badly. She was way ahead of me.
Well, thank you, Victor. I'm glad that you're finding some time to do some of those things, because clearly there's not that much going on for you at the moment.
Not true.
Nicole, final word?
Yeah, I am definitely not as busy as you are, Victor, with coordinating all of these different global leaders and support around getting this financing out. And so happy that you're doing that for many reasons. Coping with my own mental health, I think it's really taking it day by day, recognizing that this is a very anxiety-provoking situation, and so all of these feelings are, and stress is very normal and expected, and just trying to be really cognizant of that, and still, as both Garrett and Victor said, making time for things that bring me joy, make me happy. I'm reading a lot. I've done a number of things. It doesn't look quite like this with this many people. Was part of it as I looked down at the participant number, but I've set up quite a few virtual coffee and dinner dates with friends, and I think I'm going to keep doing that and keep making space for that as well.
I think Garen should send us his wonderful wine to every one of us.
That would help my mental
Actually,
health
sit back
significantly.
and relax. Hey, Garen?
You have to talk to the CEO, my wife. She's the one in charge of donations.
Tell Sherry I'll give her a call in a few minutes.
All right. Okay.
Well, listen, thank you to all the panelists. I know from my side, as somebody who's dealt with a lot of mental ill health over the years, this is, obviously, as you say, Nicole, a really anxiety and fear inducing time. And I think your advice of taking it day by day, managing the type of information and how much you're consuming, that's good advice. I think that the last thing I would say, just from my own personal experience, is I'm a pretty emotional guy. I have a lot of ups and downs anyway. So leaning into those and sort of, as you say, making sure that I'm kind to myself about what those mean, and kind of leaning into those feelings has been super helpful to me. Luckily, this is not day one of my own journey with my mental health, so that makes a difference. Thank you so much to all of you. Krishna and Judd and the organizers, thank you so much for pivoting on a dime like this. It was really impressive how you've kind of turned this around in such a short amount of time, and I really appreciated how you reached out to all of us to ask our opinions about what to do with this conference, as opposed to making an executive decision. With that, I will wrap up this panel, turn it back to you, and say thanks, everyone, one more time. Appreciate it.
Fantastic. Thank you. And Peter, for fantastic duties in moderating. Also to Victor, Nicole, Garen, thank you all for a fascinating and fantastic conversation. I know it was much appreciated. This really closes our first day. Just a few thanks. Thank you to everybody for hanging in there. As Peter noted, this was all done on a dime, and we created this whole digital experience in the last week. So a huge amount of thanks to our team here to make it all work, and for everybody to come along on this journey and experiment with us. A quick note, we know we got many more questions than we were able to answer in real time. We will try to curate the questions, get answers from each of the speakers and panelists, and get those back out. Please do continue to rely on the Whova app to stay engaged with each other. Again, we know that there's limited interactivity, which is such a valuable component of this community being together. So please try the Whova app to see if we can keep some of these conversations going. And finally, please rejoin us. We're starting again at 9 a.m. sharp East Coast time tomorrow. Thank you to everyone. Have a great afternoon, evening, and night, and talk again soon.